Welcome back. The past couple of years, by any measure, have been tough. The pandemic has disrupted the world, and now more than ever, there's a tremendous focus on the importance of the healthcare industry. For digital health, it's a tale of two halves. On the one side, you've had this tremendous acceleration of a transformation that would have happened over years, whether it was remote clinical monitoring, whether it was remote clinical trials for new medicines, or whether it was remote visits to the HCP, the doctor. You get the point. Everything went remote. But on the other side, there's been tremendous challenges. In some areas, the pandemic, through isolations and lockdowns, have had a negative impact, especially in areas like cancer care, where patients haven't been able to get screened and diagnosed. A study last year found that in Europe alone, 1 million people went undiagnosed for cancer. That means that walking around every day is 1 million people who do not know they're burdened by this disease. It's estimated it will take 10 years to remove that backlog in the healthcare system. A healthcare system that before the pandemic was already stretched and under strain. Cancer care progress has been pushed back by a decade from the pandemic. And the only way we're going to be able to accelerate that is by harnessing and leveraging the power of data and advanced digital technologies. This is where you come in. This morning, we heard about some of the challenges in digital health. And now, we're going to hear about some of the solutions from a series of trailblazers who are forging the path to new areas that we can use to tackle digital health in Europe. And to kick that off, we're going to hand over now to Patricia and Nishant, who join us virtually from Deloitte, to talk about exactly that, the future of digital health in Europe. Over to you.
Hello, everyone. It's a pleasure to be here today with you to talk about the future of health and our perspectives from Deloitte. I just want to check, do we have the slides up? Folks see the slides? Perfect. Excellent. So as a quick introduction, I'm Patricia. I sit in our Deloitte practice here in Switzerland and am the leader of our Future of Health initiative here in Switzerland. And so what we're going to talk to you a bit about today is how we perceive that future evolving as we look towards 2040. So really taking us beyond the days of the struggles and the opportunities that the pandemic has created in improving our health systems and really fast forwarding to that point. We're also going to talk a little bit about what the trends that we see and the impacts that we see here in our local Swiss market, and talk about what the impact of ecosystems and things like DayOne, being able to bring together multiple parties to solve the system, is crucial to getting to that future. So if we move to the next slide. As we project ourselves into the health in 2040, we believe there are two independent but really provocative changes that are happening in the healthcare at this moment, and that will fundamentally change the way the healthcare system operates. The first point is the explosion of data. We know data access, analytics, and the availability of information with wearables, being able to connect that data, we have more robust information than we've ever had. Couple that with the continuing education and health literacy of the consumer. Previously, consumers were more docile, would show up simply saying, I don't feel well, and trust and rely on the opinions of their care professionals. Now we know consumers are more agitated. They show up being able to list their systems, what they believe their diagnosis is, what they believe should be done. Data explosion and active consumerism coupled together forces the system to evolve from a provider-centric system to an increasingly consumer-centric system because these consumers are more demanding, they're more informed, and are able to get that information, insights about their health outside of the traditional brick and mortar and classic structure. The implication of that is the way value is created. We'll move from sick care moments and sick care procedures and sick care payments that are typically late stage in disease and highly complex interventions towards payments that are much more micro in nature. These micro interventions and micro adjustments, running and rolling in combinations to avoid changes in your health progression, to avoid health issues before they happen, to maintain wellness. This value created will be done in smaller chunks and smaller payments. It will be incremental over time, but we do believe that the overall system is going to convert into this heavily patient-centric, focused, and data-enabled vision of the future. If we go to the next slide, as we consider how we move to that future, we've broken down some of the key components of that future of health. And this allows us to dissect the applicability of each individual components across healthcare markets, whether that be in the US, here in Switzerland, or across the rest of Europe. We highlighted 9 themes to assess the degree to which the criteria is mature in the areas of consumer activation and empowerment, integration, interoperability, and competitiveness, and the institutional and regulatory readiness. Now, when we took this lens to the Swiss market, for example, I think we found really 4 areas of high impact in particular. Consumer technology adoption and data privacy concerns. Clearly, this is critical. And as we talk about what's really important to readily adopting and actively using technology. And I think what we found in Switzerland is certainly people's technology behavior is driven by ease of use and convenience, and the fact that they have a high degree of trust. However, there are obviously perceived risks, poor digital readiness that prevent people to believe in the health-related systems and devices. As an example of kind of this convenience and trust in public institution, people may know SBB, it's our Swiss train organization, and they have a platform, an app, which approximately 4 million people use to book, pay trains, bus, ride on ships across Switzerland and its adjacent states. That covers about 60% of the population here in Switzerland. Again, that's based on perceived added value, cultural characteristics, and trust in that system. We also highlight individual agency and shift towards prevention. So here, how do we assess the degree to which consumers are seeking to be active participants in their care? And how is the health ecosystem moving away from a reactive model, supporting by incentives and policies of these key influencers? And I think similarly in many markets with private insurance, we see here influencers such as Helsana in the Swiss market delivering programs that really incentivize their clients and customers towards health risk and prevention, aimed at reducing overall healthcare costs. Another one we highlight is the degree and data of interoperability and system integration. Obviously, all of this is based on not only the data being available, but being able to integrate it. And I think here, and in a number of other similar markets, we still have a long way to go. I think the design, goals, and measures to drive digitalization in the healthcare sector have been strong. However, recent votes, for example, in Switzerland for electronic health records have been declined by the public. And the last point that we want to talk about, especially in relation to Switzerland, is an innovation culture and prevalence of non-traditional entrants. I think Switzerland is such a strong culture and such a strong place for innovation. It's been named a global innovation leader with strong culture for over 10 years. And I think the fact that it has this culture and industry focus in health, regulations, and talent, critically talent, available here, I think it will consistently rank as one of the top countries in innovation due to the intense investments that we make into R&D. I think underlying all of this, as I mentioned earlier, is really how do you establish the right ecosystem? How do you establish the right connectivity of these players that are ultimately going to enable better patient care and ultimately better consumer health? So with that, I'll turn over to Nishant to talk a little bit more about the ecosystems.
Fantastic. Thanks, Patricia. Just a quick check if you all can hear me. Mm-hmm. Fantastic. So a quick line of introduction from my end. I'm a director within the Artificial Intelligence and the Data team and focus primarily on data analytics and automation. What it has helped us do is to understand what does this data ecosystem of future look like. We have been working very closely with a lot of life sciences organizations and startups, and we have realized that while everyone understands that there is a value in these data points, it's increasingly difficult to bring different stakeholders and their aspirations and expectations onto a common platform. And that's where ecosystem enablement starts playing a key role. We believe that the right ecosystem is going to be key to realizing the future data economy in health. So if you go to the next slide, please. We are seeing increasingly organizations come together. A lot of the organizations are kind of focused on enabling better experience to their consumers. At times they are utilizing generic platforms, at times they are coming together with specific vendors to build one, but there's a lack of a common platform allowing interoperability of the data, interoperability of the services, having a seamless experience that doesn't rely on your specific service provider to be on that platform. Here are some examples of how we see that kind of coming together currently. So in the Swiss region, we see organizations kind of coming together to have cross-policy holders experience a common service experience setup. And that's the example that you see on the top. It's through a application which is built by a technology company, but then allows policyholders of Visana and CSS to have this common experience through an interactive and straightforward setup. If you go to the next example, that's kind of taking you to a different level. No, please stay on that slide, please. And on the previous slide, we talk about the Zurich example together with the LiveWell, and it's more focused on your day-to-day interactions and how health can be influenced through your proactive interventions. The same examples kind of extend globally as well, whether we are looking at governments and hospitals coming together, whether we are looking at national health services coming together, or whether we are looking at even retail participants coming together. The key thing to realize here is there's a lot of data that's flowing around. And without understanding how this privacy around this data needs to be maintained, we may inevitably step onto an area where patient data in zones that shouldn't have been accessed is made openly accessible. And that puts the whole data economy into question. It puts the patient rights into question, it puts their privacy into question, and it puts really the insights that is derived from it into question. So if you go to the next slide, the way we see the data ecosystem come together is going to be driven by three questions. Who will enable this ecosystem? How is the ROI of that investment going to be driven? What is the financial incentive around it? Does it need to be driven by government institutions only, or is there a way that public and private parties can come together? What can be shared in this ecosystem without compromising the privacy of the individual concerned? And how will it be shared in the ecosystem? Does the user at the center has access and control over it? A lot of these questions have been individually tackled by corporates and startups. And one of the initiatives that Deloitte as a firm we are trying to drive is around HealthX, which is basically bringing together the resourcefulness and scale of corporates with the agility and the user centricity of the startups. We'll talk a lot about this in detail in the afternoon masterclass, which I'll be conducting together with my colleagues, and give you a view on how this particular ecosystem is being enabled. So we look forward to having some of you participate in it and discuss your views there. Thank you.
Cool, thank you guys so much. A couple of questions that we've got from the audience here. Patricia, the first one over to you. Look, the challenges that we have with so much data now coming to the floor in Europe, how is Europe going to address some of the data privacy concerns?
Well, as we look, I think, around the globe, Europe, I think, has taken a leading role in addressing data privacy concerns with GDPR. And I think we'll see that trend continue. I mean, honestly, I think with the explosion of data, and if we're going to start using that data, we need the right policies and the right governing bodies around how we address that. And I think it can't be, in this case, lagging regulatory. It has to be leading regulatory. So I do believe that, while sometimes businesses and we in life sciences and as pharma companies feel like it's a constraining environment, I think it's the right direction to be heading, because ultimately trust in the system has to be the primary goal, because otherwise all of this falls apart.
Yeah, absolutely. It's about that integrated healthcare ecosystem coming together for the betterment of patients and the system itself. And I mean, on that note, so thank you, Patricia. On that note, Nishant, what are some of the barriers to the marketplace for the ecosystem to break into that? I know you'll cover some of this later on, potentially in the masterclass, so just a light touch on it.
Sure. I think there are a couple of key barriers that we have seen, primarily focused around who and how they are bringing the different parties together. I think in a lot of cases, the initial selection of the parties that come together and their aspirations needs to be very much aligned, both in terms of financial and the area that they want to focus, what sort of experience they want to pass on to the consumers or the users, what sort of financial proposition they are looking at. And generally, we have seen that in the first few steps of the whole ecosystem enablement, 60% of the whole conversation fails. So to us, getting the right parties together, getting the right people with the right aspirations and expectations together is key to making the ecosystem work.
Absolutely. Cool. Well, but thank you both so much. For those who are going to stay around for the afternoon, please do check out the masterclass with Deloitte. But up next, talking about the ecosystem and what's critical for it, is the guys with all the money. So up next, we've got Felix Falten from Speed Invest. And as the name suggests, how can they get more money to more startups faster? Over to you, Felix.
Hi, my name is Felix Falten. I head digital health investments at Speed Invest. We're a pan-European early-stage venture capital fund with over 200 investments across the continent in a whole range of different sectors. I'll be speaking to you today about funding the European digital health ecosystem, and there's a very clear reason and simple reason why we're particularly interested in that topic. We're at Speed Invest one of Europe's largest seed stage and pre-seed stage digital health investors. We have a portfolio of 17 companies across 8 countries, ranging from consumer to B2B models, and at this point pre-seed to Series B. So we're upstream investors. We look at 1,000 digital health companies every year, and we have a very keen interest in understanding where the funding landscape for digital health might evolve. Typically, when we ask this question around where will digital health funding go, or where will the digital health ecosystem evolve to in Europe, one obvious starting point is to look at the US and to draw some comparisons there. So I'll start with that before moving on to some of the more European trends we've been seeing, and concluding with some high-level suggestions for where we might end up in the next 2 to 5 years. So I think the first thing that's important to understand is digital health is very much niche in Europe compared to even other sectors of economic and startup activity. So digital health funding on this chart, you can see at 2.4 billion was roughly a third of the e-commerce startup sector and a quarter of fintech. Taking a step back, all of Europe is actually very much niche compared to digital health in the US. So this chart compares digital health funding in the US on the right with roughly 23 billion, with some lumped together sectors on the left in Europe. So fintech, e-commerce, and digital health again. Just comparing like for like, digital health funding in the US last year was roughly 9 times that of Europe. So huge gap there. And we always wonder, where does that gap come from? The first hypothesis is typically capital availability. That doesn't entirely explain what we're seeing, since venture capital levels in the US are only 4 times as high as in Europe. The gap in health is 9 times. So there's something going on there that clearly doesn't just have to do with the availability of capital. One area to look at is just where do investors set their priorities, right? And so this chart compares overall VC funding for digital health in Europe and the US, and the difference is striking. The US VCs spend 10% more, allocate 10% more of their capital towards digital health. So 7% of all VC funding in Europe goes to digital health, 17% of VC funding goes towards digital health in the US. That's a huge discrepancy. There are some very practical reasons for that, namely that investors face completely different orders of opportunity in Europe versus the US. So this chart shows on the left 37 digital health exits in Europe over the last decade. And it might be 50 at this point in 2021. We haven't gotten the latest numbers yet, but compare that for a decade to the last year alone in the US with 145 exits. So there are completely different orders of magnitude in terms of the likelihood of exiting companies, generating liquidity and returns for investors. And then that obviously reflects on the type of capital they allocate and the amount of capital they allocate to digital health opportunities in Europe in the first place. On the other hand, we see a big opportunity still, because in Europe, capital does not track economic output. And on this slide, I compare on the left the share of venture capital, fintech versus digital health. Digital health gets roughly half of what fintech gets. On the other hand, on the right-hand side, you can see that the health sector as such accounts for almost twice the amount of economic output or GDP as does the financial services industry. So there's a gap there. Digital health is undercapitalized, health is undercapitalized, and that's why we're long on the opportunity, and that's why we think that there's still very strong growth in digital health funding in Europe ahead of us. There's also a public health perspective on why digital health in the US is more advanced, and it's that there is a huge access problem in the US which drives the demand for digital health. This chart, and there are many like it or many different ones that we could have pulled out here, just compares for a given level of medical need the probability of visiting a doctor, in this case physical primary care doctors in the US to some other countries in the OECD. And the US is is at the very left tail, almost one of the lowest probabilities of people actually going to see a doctor. A multifactorial phenomenon. Surely at the same time, it's clear that if people cannot access healthcare face-to-face, it creates an incredible opportunity for digital services, digital care, and that doesn't exist in the same order of magnitude in Europe. And that's also one of the reasons funding has trailed far behind US levels in Europe, is we simply have in Europe a slightly lower need for digital health innovation. Very controversial, and actually I don't think that's true entirely, but over the last 10 years, that's definitely one of the things we've seen play out here. So where do we go here? We've seen that in the US, digital health funding is 9 times that of Europe. We've seen in general that venture capital funding in the US is much higher. Where do we stand? Where do we think we'll head? European VC funding has been exploding in the last 1.5 years. This chart from Dealroom shows that especially at beyond Series A, mega rounds have just led to an incredible volume in venture capital funding in Europe. 49 billion in the first half of this year alone in Europe, which is a mind-boggling number to anyone who's been active in the startup and venture scene in Europe for a while. So the overall level of funding in Europe is rapidly exploding. At the same time, slightly more longer term, we have seen digital health funding in Europe catch up at a much higher rate and grow at a much higher rate than funding for other sectors. So this chart just compares digital health in Europe to fintech, e-commerce, and digital health in the US. Health funding has grown 9x over the last 5 years. That's a faster rate than some of these other sectors have seen. Driving this and underpinning this, and perhaps more importantly, we've seen that company formation in digital health has also accelerated in digital health more than in other sectors. So there's almost been a 3-fold increase in the number of company formations in digital health over the last 5 years. We look here at funding rounds, but it's a decent proxy for the number of companies formed. And so there's more funding overall, but there's also for 5 years now been a consistent increase in the number of founders going into digital health, starting up health companies. And that's obviously going to have an impact on funding as well, because this talent will attract funding. Very importantly, I've mentioned that exit activity in Europe is at a very low level still compared to the US, but it's picking up, and we do expect that even this year, 2021, will set a new, very clear record. That's important. It creates opportunity for investors. It creates liquidity within the ecosystem. It releases talent to start new things. So we do think that based on more people founding digital health companies, the overall funding levels being up and exit activity picking up, to see quite a robust increase in digital health funding over the next 5 years at least. I put on this slide what we expect over the next 24 months, because it's quite a risky thing to make longer term predictions at this point. But these 3 predictions I feel very, very comfortable with. So first, as I've mentioned, we do expect continued early stage growth driven by the general interest in health at this point, driven by the overall rise in funding levels. That's a trend that we've seen and that we continue to believe in. There will be more and more early stage digital health companies founded. We see a lot of people who previously would not have entered health starting companies in health. We see a lot of health experts who perhaps would not have started tech companies thinking about founding tech companies now. So there will be a rising tide of early stage companies. On the other side of the spectrum, mega rounds will continue to happen in some of the more established players in Europe, and they will unleash M&A activity. A lot of these companies are raising capital in order to acquire smaller players across Europe, again driving exits. A lot of this cash, be it through exits or be it through angel investment activity by some of the operators in these companies, will flow into the digital health ecosystem, so that it has an important multiplier effect. And also these mega rounds will give a lot of the people who know what great looks like a clear incentive to get something started on their own, to start the next digital health company in Europe. So these mega rounds are very important for the ecosystem, especially in combination with the sustained early stage growth that we're seeing. Finally, I think it's important to understand that European champions will attract global funding. We've long passed the stage where European companies only get funded by European investors, and this will also increasingly be true of digital health companies. Leaders in Europe, category leaders, global digital health leaders from Europe will have no problems at all raising capital from international investors. And again, this is important because it brings information and expertise from those investors into the European market. It brings in additional pockets of capital, especially at the later stages. And so these 3 points together kind of sum up to create a sort of virtuous cycle where we expect for the next 24 months at least, and probably for the next 5 to 10 years, very strong general uplift in digital health funding in Europe. And at the end of the day, that's a positive thing because we also think that patients and end users stand to gain from a lot of the innovation that this will fund and drive. Thanks for paying attention. Enjoy the rest of the conference. And if you're an early stage digital health founder, get in touch. I'd love to have a conversation. Thank you.
Well, we can't do questions with Felix because he's actually on paternity leave. So congratulations, Felix, to you and your now extended family. Coming up next, we've got Renata from Noema, and Renata focuses on orphan diseases. And one of the challenges that Renata focuses on is primarily in pediatric care. Over to you, Renata.
Thanks very much for the introduction, Rob, and good morning, everyone. My name is Renata, and I'm really happy to be here on behalf of Noema, which is a Basel-based company, but possibly not yet that known. If I could have a next slide, please. So we are going to change perspective now, and from talking about the ecosystem, health ecosystem in general, and then by Felix about the investment landscape, we are going to dive in a bit deeper on one particular area of the ecosystem, and that is the drug development area. So first, maybe just to introduce quickly Noema. Noema is by company H, young biotech startup. We have been founded exactly 1 year ago, last November, and we have a pipeline of 4 clinical assets that we are developing and have focused on central nervous system, primarily rare conditions, but above all on symptom control and functional restoration, which is actually something that is common to all our programs. I lead a program developing a highly selective negative allosteric modulator of a brain receptor for the treatment of seizures associated with TSC. So next slide, please, so that I can explain TSC abbreviation. TSC stands for tuberous sclerosis complex. And just to give us a context, TSC complex definitely is a very complicated disease. So TSC is a rare genetic disorder caused by a genetic mutation that leads to a growth of tumors. These are benign tumors, but nevertheless, they grow in organs like brain, heart, lungs. And the disease also has quite typical skin lesions that you see on this little picture, on the picture of this little boy here. So TSC also causes behavioral abnormalities, developmental delay, autism. And when you think of a family with TSC, there are a couple of things to consider. Because it's a hereditary disease, you might have more than one child in a family with complexities it brings further. The cognitive delays and behavioral issues have really main impact on family life and the social functioning of a family. And the disease requires lifelong monitoring and care. So what I didn't say yet is that about 85% of people with TSC have seizures, and over 60% of those seizures are not controlled by available anti-epileptics. So that's where Noima comes into place. And next slide, please. We are starting a phase 2b study to evaluate the efficacy safety of one of our assets on seizures associated with TSC in pediatric population. So I will share with you the experiences from setting up the trial, but maybe a side comment, which is partly relevant, is we decided to call the study, or to name the study, Galeen, which is a Greek goddess of calm seas, and as it reflects our ambition to contribute to calming those overexcited neuronal connections leading to seizures. And I'm mentioning it because throughout the presentation you will see the cartoons like this one from the Galeen cartoon book that we developed as part of our educational material for the patients. Next slide, please. So thinking of what this conference is about, how can we change the future of health and the future of medicine in Europe and beyond, hopefully? I think one principle is really partnering with those people who are concerned and impacted the most. So this is one of the operating principles for Noema, that we actually never start a program without understanding what are the needs of the patient population, patient in a broad meaning of the word. Because when it's patient, it's also a family, it's also a person with a life, it's also society that are impacted. And there are two attributes that come to that partnership in my mind. And one is getting early input, and the other one is continuous collaboration. So that's kind of what you see here. So thinking of the early input, one of the things we have done was that we included a patient, or rather caregiver, into the advisory board we're designing the program. And we learned that while our focus seizure is possibly the most dramatic symptom of the disease, the one that is most concerning to families is possibly something different. And it's very often the behavioral aspects of the disease. And based on that feedback, we included a new patient-reported outcome into the program, which we'll be measuring not because it helps directly our primary objective, which are seizures, but because we see this as the very important aspect concerning the family and the actual patient community. Our trial has some other components that are listed here. So we will be having many of the visits are done remotely. We provide educational material electronically and not, etc., which is all part of the experience we gained, or the knowledge we gained from the experience the patient community is making. On the other side, this partnership also requires continuous collaboration. So we have established a true partnership with the TSC Alliance, which is the strongest patient association in this area, with a very strong US chapter, but also international network, and are working with them as the trial progresses. And for example, our site selection strategy was very much based on the principle of understanding where are the patients, how can we connect with the sites that are seeing those patients, and that went through the association. So you would think everything is wonderful. If I could have a next slide, please. But to be very honest, it has not been a smooth sailing all the time. So a bit rough waters that we experience. And I guess on expected side, so we have been challenged by the regulators on the remote visits, which of course point taken because it's from the patient safety perspective. But I think the last year taught us that a lot is possible to do remotely. So that was one challenge. In terms of how we set up the trial and all the related procedures, we have been also challenged by our CRO. So we are a small team, and that's why I'm working with a CRO for the whole implementation piece. And what surprised me really was how kind of like not up to our needs, if I can say it so, are often the service providers are. So thinking of complexities of getting your family to the clinic for the visit, we wanted to have as many as possible remote visits, which requires direct-to-patient clinical supply delivery. And while you can have lunch delivered here for a very little extra charge by eat.ch or whoever else, to have the medication delivered to the family home is actually not as easy. It's far from easy. It has a pretty horrendous, from our perspective, cost. It's a pretty prohibitive cost. And also the business model is not really meeting the need of this patient-centric approach to trials. And I think that's where we started to think it actually needs more than this commitment to the patient centricity. It actually really needs the change in the ecosystem, just to use the word that was used before and to refer to the previous presentation. So on the next slide. In conclusion, I think with thinking of those experiences, the key learning for me is, as the title says, it needs everyone. So we often hear pharma needs to be patient-centric, and I absolutely agree it has to be patient-centric. But then everyone has to be. And I think what we need more of, and what I think experiences like this one help us is to improve kind of the future, is bring together all the key players in this process of developing and bringing medication to patients, is from the patient community, through clinical sites, through all the active players like the CROs and pharma and everyone. But similarly so also the service providers who need to be kind of, again, thinking of the end customer when defining the business models, and hopefully this would lead also to making it easier to run patient-centric trials for companies like Noima with limited resources when it comes to money and time. So just as a food for thought, it needs everyone, and it needs kind of that mindset across the whole ecosystem. So with that, I would hand over back to you, Rob, and answer any questions if there are any.
Yeah, absolutely. Thank you so much, Renata. It's always great to talk to you, and your passion for patient centricity really comes through, even virtually. So thank you so much. But I think one of the questions that really comes through is, how will this approach really drive clinical change? Like, what do we need to do at the clinician level with service providers in order to really embed patient centricity in everything we do, so it goes beyond a buzzword and a topic and really into action?
So I think if kind of what it brings is better medicines for the patients, because if we understand what they need, we will be able to deliver what they need. I guess there is no other industry that would be not checking with the end customer what the needs are, or at least not checking the prototype. And I think that approach is then really required for all those players, and that mindset, and it's possibly more mindset because then the rest comes.
Perfect, cool. And one other question whilst I have you. Biotech, based in Basel. Why Basel?
The best place to be.
There we go. With that, we'll move on. Thank you so much, Renata.
Okay.
Speak soon.
Thank you, Rob.
So coming up next, we've got a company that needs no introduction, the world famous Google, and Christina talking about some of the biggest things happening in digital. Over to you, Christina.
Thank you very much, Robert. So my name is Christina Basmalis. I lead the life science industry within Google Cloud in EMEA, and very happy to be here. Spent a lot of time at the slide's coming up. There we go. Spent a lot of time at Novartis in my prior life at another company, and so nice to be back in the room. And today I do want to talk around really, and it really links in nicely to the other conversations we had already with Renata and Deloitte, around the journey to personalized healthcare. So, Google. Our mission, which has stayed the same for the last 20 plus years, is to really organize the world's health information and make it universally and accessible for everybody. We really, if you think about it, we get billions of searches, billions of videos, billions of everything a day, and we're able to manage that through our secure capabilities, which we also offer to our clients. Of those billions of users that use Google to manage and embed it into their lifestyle, we also know that there's questions that come around health. And we also know that if you have a patient or a person that can answer those health questions, they can also have better outcomes. So really our goal is to help that consumer manage their health and provide information as necessary. So when you look at a health perspective or healthcare, we really want to organize the world's health information and make it universally accessible and useful. And within healthcare and life sciences and in Google Cloud, we want to be that web. We want to be that connection, that interconnection across the ecosystem. And this aligns very nicely to the discussion of ecosystem, to really, again, bring our capabilities to market to help our clients that are overloaded with data turn it into knowledge and actionable insights. We are driven by health equity and doing what's right for the people around the world to bring it really accessible and useful for everyone. 4 key focus areas that we have: accelerate time to market, transform operations, patient-centered experience, and reimagine business models. I won't go into every one of them because I only have 10 minutes. But on the reimagine business models, you know, if you think about Google, you think about innovation. We are an innovative company. We like to focus on 10 times thinking, bringing really the most challenging problems that we have in an industry or with a client and how we can actually transform that. Partnership with Mayo Clinic is a good example within the healthcare space that we are looking to redefine how health is managed and embedding that and infusing that with digital technologies and innovation. We've set up an AI factory with them to do it at scale. An example is around the radiation therapy, where we're using anonymized or de-identified images and healthcare data to identify the best treatment plan around radiologists for oncologists to manage with their patients. In 2014, the NIH identified the quadruple aim. What are the 4 key factors or 4 key challenges that we have to bring health better into the society? And I won't have time to spend on each one of these, but they make a lot of sense. They're all interconnected. We have the improved healthcare HCP experience. How can we really digitally assist them better to do their life, to do their job, which is very much overworked, and challenges around burnout, around too much administration. We have better outcomes. Again, if you think about it from a pharmaceutical perspective, really looking at how much AI or ML can really change the way we do things today. We need to get faster time to market and bring our solutions and capabilities to the patients. Lowering cost. You could say COVID set the marker, which was really interesting, of going from 10 years down to 1 year for a vaccine, 10 years plus, and has really challenged, like, how can you do things better and cheaper, but really drive, again, equity across and move away from the volume-based to value-based. And finally, where I want to spend my time today is around patient experience. Again, it's very important. If you think about telehealth explosion over the last couple of years, due to COVID and even before, really empowering the patient has been talked about earlier today, engaging the patient differently. And digital can help with that. But, interestingly, a study by IQVIA recently on digital health trends, in 2020, there were over 90,000 digital health apps launched on the market, on app stores. 90,000, 250 a day. And that equals to almost 350,000 total. And we saw also that there's a decrease coming. So is that really the answer, to have a plethora of information? I was speaking to a fellow colleague today, and my sister is recovering from a rare disease, and at the moment she takes about 30-something pills a day, and they change every couple days. She goes back to her oncologist, and they again mix it because it's very personal. I was there visiting her back home in the U.S., and I wanted to say, okay, how can I help you? Besides taking care of her, how can I help you? And again, I'm a digital person. I want to be very digital focused. So I looked at, let's look at the pill situation. There's so much medication you're taking. It changes so regularly. We got to find a digital solution that can help you. Spent the day. I downloaded 40 apps, over 40. I played with them. I looked at them. I didn't find one that would work for my sister because it's an individual situation, and actually understanding that patient experience and need due to the fact the medication changes all the time. It's not linked with the pharmacist, not linked with the oncologist, and so on. So you need to look at the patient and experience from that side. And that, of course, all leads to data. Lots of data, constant issue we have, and we need to integrate it. If you look at this picture here, we have all different areas of looking at the holistic view of a patient and finding the information needed, whether it's to predict the disease for the patient, it's to help them manage the disease, it's running diagnostics better. All those areas are so important to bring that data together, and it's siloed, sitting in different organizations around the ecosystem, but also even within an organization siloed from that side. I also want to call out specifically social determinants of health when you look at personal health data, because this is critical for us. In recent WHO, World Health Organization study, there was basically around 50% impact on outcomes due to social determinants of health. Things like, where do you live? What's your financial situation? Who's your insurance company? What's your family caregiver situation? There's dozens of them. But we need to also take those into consideration and unlock value. With time being short, a quick traditional patient journey. So you have Dolores. She's 45 years old. She's got a couple kids. She worked in a retail store. She struggles with severe asthma. One of her daughters also has allergies. She doesn't feel very well, so she wants to talk. She says something's wrong, wants to contact her doctor. It takes a couple weeks to get there, and then she really only spends about 7 minutes with the doctor. Has challenges paying for it, has to give up something else to pay it. In the same time, she's got to deal with her daughter's health, and it's quite severe from an allergy perspective, so they have to move to find a better ventilation system. And then, the doctors give her different prescriptions to try out. She has, is this going to work? I looked on social media. The information doesn't look so positive. Maybe it's not my demographic. And then finally, it does work. But is that the answer? She knows she's got to change her lifestyle, and this may work temporarily, but she doesn't have the resources to do that. She doesn't have the resources to go forward. Probably a typical example for many different diseases people may have, especially in chronic diseases. So what do we need to do? We really need to infuse that digital journey, not just a piece of it, but across the whole side of the area. And I put 4 boxes to simplify it. You have awareness and education, you have diagnosis, you have commenced treatment or maybe even trial, and you have monitoring and adherence. And there's solutions that can go across all those aspects, but for all the time, we need to think about the patient through that side. And just a few examples with my 2 minutes left. You look at on the awareness and education. Diabetes UK in the UK has partnered with Fitbit, which is part of Alphabet and Google, to really address prevention side of it. So looking at how can you actually inform people up front from prevention. Part of this is around connecting with the Know Your Risk tool. And the first week, 300% increase on the tool, and over 40% were high risk out of that Know Your Risk tool. So again, can you get early and stop it from happening? YouTube, we all use YouTube. I know we do, right? I do all the time. It's become very popular also around education, especially in the health space. And earlier this year, we've actually announced that we want to have very much a different channel for health that gives easy to understand information from a trusted source or trusted sources. For example, Mayo Clinic or Harvard Medical or Osmosis and the like. Interesting to know that during COVID the last year, 130,000 videos were removed because of COVID vaccine policies that were blocked. So really important, trusted information. You may know of Osmosis. It's one of the leading medical education systems. They have 2 million followers on YouTube. You may also know Dr. Mike. Dr. Mike, GP in New Jersey, he's got 7 million followers. Something's wrong here, right? We need to address trusted information. Another one, DermAssist, is really about someone educating people and helping people specific to potential skin rash on their or skin disease on their body. This is not a diagnostic tool for doctors. This is for people. They can upload a couple images. It's screened against with AI against over 300 conditions, and based on that, it comes with information that the person can use to decide what to do next. We have, again, I'm running out of time here, so AMWEL is a virtual health, telehealth capability in the US, not just a video, but really around how you automate capabilities, looking at check-in, waiting times, translation services, intelligent triage for providers, again, benefits for both the patient and the provider. And then as you move down into managing and monitoring side of things, we have some great solutions with Onduo, who's part of Verily Group within Alphabet, using digital phenotyping. So really getting precise information at that point. It leverages an array of technologies and sensors, but also virtual care. And back in the UK and in Northern Ireland, we have a program with Our Hearts and Our Minds, which again is partnered with Fitbit to look at how you can actually use wearables to improve cardiovascular health. They moved from a complete program, which was on-site, to remote, with very positive results and benefits of being able to do that, taking the data from Fitbit and providing behavioral information and changes back to the patients. I'm out of time, but basically, there's a ton of technology out there, right? We can do great things, but what came out very clearly, and I agree 100% with Renata as well as with Deloitte, is the ecosystem doesn't work for that right now, and we need to fix that and address that as we go forward. Thank you very much.
Christina, thank you so much. You looked at me when you mentioned Dr. Mike, and you saw me going. And if you haven't Googled him yet, Google Dr. Mike and you'll see why he has 7 million followers. Everyone wants to know, how do they work with Google? Such an amazing company, has such amazing technology and talent. How do you get access to that?
Get access to Google. I mean, well, as a consumer or as a company? As a consumer, everyone has it. As a company, we really want to work with companies. We want to innovate with you. So getting access to us is about, come with your challenges, come with your biggest problems. How do you want to transform? How do you want to be part of the ecosystem? And let's innovate together. Very simple, right?
There we go. The power of innovation directly with Christina from Google. Thank you so much.
Thank you very much.
Thank you very much. And coming up next, we've got Blaise from Zuko, who's going to talk about the importance of precision medicine, but the connected health and the digital health that we need in order to get that data revolution to get there. Blaise, over to you.
Thank you very much, Rob, and good morning or almost good afternoon to everyone. So I'm going to tell you today about a topic which I think is very fascinating. It's the health data revolution, or how new connected technologies and digital health platforms enable the rise of what we call precision medicine. So I'm Blaise Jakulkowski. I'm a principal business consultant at Zulke. And if you don't know our company, I'm just going to say a few words about it. So our motto at Zulke is empowering ID. So basically, we are a consulting and engineering company, and we build products and solutions, bespoke products and solutions for our clients. And we really have a positive outlook on innovation and technology, as we believe they are a positive force of change for business and society. And we really stand by some of our core values, which are sustainability. So we've been around already for more than 50 years. Today, we have more than 1,400 employees across 16 locations in 10 different countries. We fully owned by partners, so we have more like a long-term outlook compared to listed companies, for example. And we have also the required certifications in order to build medical products. So let's first define what we're talking about. What is precision medicine? So you might have heard this term. So this is actually kind of a mindset shift, because we're moving here from a sick care model to a healthcare model, which means that today most of the time and resources are dedicated to treat people once they are already sick and sometimes a bit too late. With a proactive and tailored healthcare approach, we can mostly try to prevent this disease to happen and provide treatments which are really unique to each patient. So these are the 4 Ps that define precision medicine. Prevention, as I mentioned, but also participatory, because in precision medicine, the patient is really at the center and is also actively involved into its treatment. Personalized, because now with the power of data that I'm going to talk about today, you can really provide a treatment which is very specific to the genetic makeup of a patient, as well as to his environment and the conditions in which he lives in. And last but not least, predictive, because with the power of artificial intelligence, we know today how to predict relapses, for example, in some cases, or the onset of new symptoms, for example. So there has been an exponential growth of data in healthcare for the past few years, which is a good thing in a way, but also it comes with some challenges. And to achieve precision medicine, you need a lot of data, but you need also quality data. And this amount of data every year is quadrupling every second year. So there would be a lot of value in figuring out actually if there's anything interesting in that health data. So just to give you two figures, the first figure is 50 petabytes. 50 petabytes is the quantity of data that hospitals generated last year just for imaging. And as of today, or last year, 97% of this data was unused, which is a pity, as you might have very interesting insights hidden into this data. Then 10 gigabytes, this is actually the data which is generated per day per patient with a connected device. It could be, of course, more or less. But if you multiply now this number by the number of days or the number of patients, you end up quickly with even exabytes of data, which is one order of magnitude higher than a petabyte. So let me just give you a few examples of these connected devices we're talking about. And here we're really talking about the medical grade devices. So this company, for example, that is shown on the slide is called WithThings. It's a leading company, the leading company in France for medical grade certified connected devices, what we call often smart devices as well. So you can see here, for example, a ScanWatch, which measures SpO2 levels as well as ECG. You have also some smart scales, some smart blood pressure monitors. You have sleep analyzers. So there's a whole range now of this type of devices which have been properly certified and meeting all the regulatory requirements. Then you have also some sensors, smart sensors you can add to existing devices. Like in this case here, you can see that, for example, you put a sensor in an inhaler, which becomes a smart inhaler, especially for the treatment of asthma. This is very useful because then now the inhaler can talk to your app on your phone. Usually the data is sent via Bluetooth to a patient app, and the patient then therefore can monitor the usage of its device. Now, how do you connect the data sources with the users? So on the one hand, you have all of this data sitting in what we call systems of records. You have, as we said, the genetic data, for example. You have data coming from wearables and connected devices and from electronic medical records and so on. Then, on the other hand, you have what we call the systems of engagement. So this is where the users access the data, and you need to make sure that the right user accesses the right data at the right time, and be it a patient, a clinician, or different kind of healthcare providers. So to manage this issue with this huge amount of data generated, you have the cloud. So everyone has heard about cloud technologies. I'm not going to give too many details about it now, but you might know that with cloud technologies, you have almost unlimited storage capacity, and you have also theoretically almost unlimited processing power, which could be very useful in terms of peak of activities. So you have many benefits coming with the cloud, but what you have to know is that it's not really a plug-and-play solution, and it's not compliant also with all standards and regulations in healthcare and life sciences. Therefore, you need something in between what we call the infrastructure layer, which is basically your cloud, and you have cloud providers such as Google that we heard about just before, Microsoft or AWS to just name the main ones. And on top of this pyramid that you can see, you have what we call the application layer, which are all the applications which are usually consumed in a SaaS model. So in between, you have this platform layer, so digital platform consumed as a platform as a service, where the software engineers can develop new applications and access the data. So there are different types of these digital technology platforms, but they all follow more or less the same model. On the top, you have the consumer clinical applications where you plug your devices and you have your applications. On the bottom, you have the infrastructure, which is usually managed by your IT administrator. And in the middle, you have this digital healthcare platform where you have all the services which help you make the most out of medical IoT and where you have your repositories of the data you collected. So some of these platforms are more suited for life science companies. Some are more suited for hospitals. I'm just giving you a few examples of The main ones here, most of them come from the medical device industry because they have understood the necessity to have a kind of platform to connect all of the devices in a given ecosystem together. There are many technical features to take into consideration when you select such a platform. This is more a topic for software architects. I'm not going to enter into any details here, but just to let you know that it's not a one-size-fits-all. There's a lot of integration work to do, and selecting the right one is not so straightforward. But what is for sure is that a good regulated platform needs to meet many requirements, in particular privacy requirements, security, regulatory, and quality. And it's not so easy to meet all of these standards. So therefore, you really need to put in a lot of work if you want to build your own platform. And if you want to buy one, you have to make sure that they fulfill all of these requirements. Now I'm already going to my conclusions. I have 2 minutes left. So I wanted to say here that the technologies, as I mentioned, to collect, analyze, and leverage all of these data, they do exist today. That's a good piece of news. And also, they allow you to build these digital health applications. And there are many applications on the market, but there are still more to come because there's still a strong need to solve some problems. The main challenge is really the deployment at scale. And they are both technical challenges because of legacy systems, for example, which are difficult to change. And also, there's a resistance to change in general, also coming from medical community because it means also changing the healthcare workflows. And actually, in fact, if you look at the business model of the healthcare institutions, it's not really adapted to digital technologies. So therefore, a systemic change would be really required to trigger the large adoption by the majority of healthcare practitioners and eventually move from a volume-based to value-based healthcare. And this value-based healthcare can only happen if you base it on real-world outcomes that you can collect with these connected devices, along with patient-reported outcomes. So final words is that I'm still very optimistic, actually, that we can make it happen. So that's great because the proper implementation of these digital health solutions can make precision medicine a reality, which comes with tremendous benefits for everyone in the value chain, and especially the patients. Notably, you can detect diseases much more early, which can be a game changer in many cases. If cancers are detected early, they can be cured most of the time or treated adequately. Also, you can have really unique treatment for you, and therefore you don't need to take medicines which just don't work for you. And there's a very strong emphasis on quality of life, so parameters which really matter to patients. And at the same time, you can decrease the costs of healthcare. And last but not least, and most importantly, in this case, people can really be in the driver's seat, and this is what matters the most. Thank you.
Cool, thank you so much, Blaise. I mean, I think one of the challenges that pharma have in the industry is they're not put under the same regulatory pressures or policies as tech companies. So the two industries aren't equal, and I think that creates a tension. Do you see that, particularly in places like Europe, that policy will change in order for there to be a level playing field between tech companies and healthcare and pharma companies?
I think now the tech industry and the pharma industry talk together and start to understand that they come from quite a different angle indeed. I mean, the pharma industry is rightly so quite conservative and heavily regulated, so they have quite a waterfall process of doing things, and usually that takes a lot of time. Whereas the tech industry is moving very fast. Their motto is move fast, break things, try again, and move on. And this is more like an agile approach, which is very much used in software development. But now we see kind of new models emerging, which are hybrid models, which are a mix of waterfall and actually agile models. And we have actually our own name for this at Zulke. We call it the Wagile model, which is in between a very step-by-step process-driven approach and an agile iterative approach. So it's happening now. It's taking time because it's obviously a very different also mindset, and you still have to, of course, put patient safety at first, and therefore you cannot do everything you want. So there's a lot of processes which are involved for a good reason, but at the same time you can be a bit more flexible and do some things in parallel and go more into the trial kind of mindset instead of trying to get everything perfect from the beginning.
Yeah, cool. Wonderful. Well, look, thank you so much. Really
you much.
appreciate you coming.
Thank you,
and
Rob.
Blaise from Zucker, thank you.
Thank you.
So coming up next, we've got a celebrity in the industry, Dr. Ilona Kickbush, with an exclusive from a report with the FT and the Lancet, talking about some of the challenges of a digital divide and how important digital trust is, not just for this generation, but for generations to come. Dr. Kickbush, welcome.
How do I get it started? Thank you. Well, a good afternoon, I guess, wherever you are. I'm delighted to be here and present to you some of the results of this Lancet Financial Times Commission, which, as you see, was titled Governing Health Futures 2030, Growing Up in a Digital World. You can see here the triangle that we worked with in trying to bring together a whole range of issues that are so critical. In the center is what is called universal health coverage, a concept of making healthcare accessible to people around the world equitably. And this notion of equity was very much in the center of our discussions on not what digital health brings to universal health coverage, but what the digital transformation means for universal health coverage. And we believe there's quite a difference there because it indicates that universal health coverage, that our health systems, as so many of the speakers today have already said, need themselves to change fundamentally. And we have found that in discussing digital health very frequently within the healthcare system and the kind of circles I move in, WHO and others, digital health is seen as a kind of add-on, as something that perhaps allows for a bit more efficiency, a bit more participation. But the fundamental transformation that actually comes with it is not yet considered sufficiently. You can see here that we started from a number of key questions. Again, equity, will it accelerate access, but also will it meet community needs? And I saw on one of the or two of the slides here this morning also that we cannot only talk about the individual, we have to talk about the community as a whole, and we need to talk, and I was delighted to hear that from Google, about the social determinants of health. And I'll come on to some of the other determinants. Finally, we were challenged to say, don't look at today, look at the future, and look at the health of the next generation. Some of you might know some of these commissioners. I'll just put this picture up very quickly. But you can see it's an extraordinary group of people who are actually also very active in changing healthcare systems and dealing with their digital transformations. I just want to mention two of them, Dr. Andrew Reich from the European Commission, that some of you might know, who's very active on the health dimension of the European data space, or, for example, Professor Ann Balicher, who was one of the leaders of Israel's answer to COVID-19 and the digital approaches taken there. So we were incredibly lucky to have people of that stature. I'd also mention Andrew Wyckoff, who is with the OECD and the head of the data governance work there. The way we worked was very special and very different to other Lancet commissions that tend to be very research focused. You bring the best researchers together, you look at the data and the evidence, and then you give your recommendations. We're in this rapidly moving field, and you can see here that we made sure that we had a lot of conversations with industry, with people all around the world, Africa, China, and many others, with UN organizations. And in particular, we built a youth team. we felt that we cannot discuss the future without young people, and they have been extraordinary in their contributions. This is the title of the report. Obviously, you can get it online, and if somebody's really nice to me after this talk, I can give you a hard copy. Some of the key messages from this report is that we need to understand the digital transformation as a new determinant of health. Many of the things we've heard here depend on something very simple, on connectivity. And connectivity in many parts of the world also, for example, depends on electricity. We have looked very carefully at what if we look at digital dimensions as determinants of health, as key determinants of equity to a new type of healthcare that should be accessible to everyone. So there is, of course, those determinants, let me say at the beginning, to allow you to even benefit from the digital transformation in health. But then, of course, we have been looking at the impacts when you're connected, particularly on young people, and some of our commissioners worked in particular on the mental health impacts of the digital transformation. We also saw, and we've had a lot of talk around data here, that there's a lack of culture of data justice and equity. And we found, and I also noticed it on some of the slides I saw earlier, there's a whole lot of dimensions that you think about, but equity does not appear. And I think all our applications will only really fulfill the promise if obviously they are taken to scale, but also if they're taken to scale equitably, so that what we do does not increase the big divide and does not contribute to the social determinants of health. And of course, there was one more dimension that we particularly highlighted and became so clear because of COVID-19, that we have severely neglected the public health sector. And again, many of your contributions today focused on the health system, on treatment, on some of the preventative dimensions that are so important. But this thing in the middle, public health, which is so dependent on population health data, which is so dependent that people are willing to share their health data. And we've seen that with many of the COVID-19 policies, that has been neglected. And we have in the report also some discussions around what vision of public health, what vision of a data-driven public health do we need to have, and how does that differ from an understanding of a new thing that is also being developed. We heard about precision medicine, precision public health is also an issue that is being discussed. We we engaged in a conversation with over 20,000 young people around the world to understand their experiences of digital connectivity. And it's very interesting if you look at what it is that they call for. They call for a human rights-based approach to digital health. They want to be supported in developing digital skills. We heard a bit about that this morning as well. And they asked for participation and inclusion. And you will see, if you look at our report, that there is a statement from the young people where they underline in what way they want to be integrated into policy development. And we hope you'll also be able to peruse some of these conceptual and outcome graphics that we developed so that one can take this discussion forward. So We have a set of key messages that relate then to universal health coverage. If you look at the issue of health equity, WHO defines it as the absence of unfair or avoidable or remediable differences in health among population groups defined socially, economically, demographically, or geographically. And here, of course, also we have looked, and our young people in particular were concerned about how digital development sometimes reinforces structural inequalities, and that this is also reflected in digital literacy, that it's also reflected in how the health system responds to people and how it listens to their voice. So like we just heard, this requires a value-based framework for governing health futures. And we use a lot of the work that's also coming from a range of new economic approaches, for example, the work of Mariana Mazzucato, who looks at how our societies and our economies and our models should be driven by a value-based approach, with health being a critical value that we need to take forward. I indicated that we talked with young people all around the world. One of the most exciting things I think we did, we couldn't go quite as far as we wanted because of COVID-19, was to work with young people on the digital health strategies of 10 African countries who have the highest youth populations. And together with the young people, analyze those policies. And it was quite clear that the policies had exactly the kind of gaps that I have spoken about. Not equity focused enough, not human rights focused enough, not focused enough on the real life experiences of those 85% of their population. Just think of it. And still thinking about establishing health systems of the past rather than thinking about establishing health systems of the future that are based on digital from the very beginning. Because these young kids, we were talking to them, one of them said, you know, when I get up in the morning, I have to take the decision whether I eat or whether I load my phone. Those are the kind of decisions people have to take in that context. And I think it's that reality that we also have to take on. We've also found that, sadly, if we've done an analysis of the development agencies that are supporting digital innovation in low and middle income countries, and we saw quite clearly, on the one hand, they don't do enough, but on the other hand, they are really driven by a competition of pilot initiatives, of not linking to major platforms, of not talking to the private investors and the private innovators in those countries. And for us, it was absolutely extraordinary the amount of creativity you find in the private sector in African countries with whom you would be able to take developments further. So the 4 key recommendations, and you will find a lot of details about that in the report. Address the digital determinants of health, build a trust architecture, enact a data solidarity approach, and invest in the enablers of digital health. Just a word or two, I've already mentioned some things. Address the digital determinants of health, see the digital transformation itself as a determinant of health, and we've heard about some of the potential, but we've also been very concerned about some of the impacts. We've seen if there is to be significant people involvement, and consciously in our report we rarely talk about patients because it is really about the health promotion, the preventative, the public health side of things, where we need to be so much more active and interactive also. That the literacy really is one of the key issues that also came forward from the young people, and finding that interface of digital literacy and health literacy is very, very critical. And of course, we follow a range of the other UN recommendations that we need to prioritize connectivity in a whole number of ways. And of course, traditional electricity isn't always the way to go. There's really fascinating approaches, and we're linking up with UNICEF that is trying to link up every school through satellite connectivity, etc. And we are hoping to be able to link primary healthcare centers and community health workers to that. Build a public trust architecture that is absolutely critical. Will people trust their providers, trust the healthcare system, trust the platforms, and trust their governments? And we have seen in an analysis of the COVID-19 responses that those countries that had the highest trust in their governments or in their health provider systems, take, for example, the Israeli case study, you can see that then digitalization can actually support a crisis response in quite a different way than it can in countries that do not have that possibility. I've mentioned this new term we've introduced, data solidarity, and we will continue to work on that to see in what way data can be pooled, that is supported by people. We've looked particularly, of course, at countries in Europe where you have a solidarity in terms of the payment of health systems. And we're trying to see in what way can that historical acceptance of sharing funding for healthcare actually be applied to sharing data and harnessing it for the public good. And the fourth big recommendation picks up on a whole range of the 10 dimensions of digital readiness that we developed as a guidance to countries who are building up their public health and health service infrastructure and trying to digitalize it. Our work is not ending here. Very frequently, Lancet commissions end with the report. You hand it over, that's it. One of the reasons I'm here is because we're seeking conversations to take this report further. We already have the indication from our major funder, from Basel, that's also one of the reasons why I'm here, that we will be able to continue particularly on the issues of digital determinants of health, trust architecture and governance, and this deep dive into the 10 African countries. And if some of you are interested in cooperating with us on this, we'd be delighted to hear from you. Thank you very much.
Thank you so much. And you've answered my first question, why Basel is so important. There you go. So no, it's a huge endeavor that you've undertaken. And to steal an African proverb, it takes a village. And all of those commissioners you had, the youth team, which everyone loved on the chat, all the countries that you went to. You've also raised some of the criticisms of the system today. What's been the response from government to the report?
Well, we will be presenting the report to governments in the context of the World Health Organization. One of our commissioners is the Chief Science Officer of the World Health Organization, and we are just discussing with them in what way we can present it, because to some extent what we have developed is also a critique of some of the elements of the digital health strategy of the World Health Organization, which we feel did not go far enough. And so we're hoping to take this up, in particular Also with countries we have already engaged with. India has played a very big role in what we're doing. The conversation with the people in China has been very important, and the changes there over the last year have been extraordinary, and of course with the European Union. So these recommendations we want to take forward and discuss it with them. We've already had indications, particularly of the African governments, that they are very keen to work with us further on this.
Yeah, fantastic. And you mentioned it in part about some of the challenges of all of the system that needs to come together and that integrated system to benefit the healthcare ecosystem, whether it's electricity, whether it's being able to put food on the table. Have you seen industry playing a more and more heavy role in connecting that integrated system together?
Not to that extent. What we see, and I think it was mentioned earlier on also, is, for example, this lack of conversation between different industries. It starts, the health industry is here, and the tech industry is here, and is becoming a health industry. And they're not talking to each other. And we also see that in the UN system, that the people working on food and are looking at digitalization there are not talking to the people in health who are also looking at digitalization. There are some initiatives actually also financed out of Basel, like IDARE, that are trying to bring that together. And so I think there should be a big pressure to do that. Governments can't do it alone. Different ministries need to work together, which they don't. And the different sectors of industry also need to work together and then come together around a common platform.
Yeah, absolutely. And in the chat, Christian had a great comment around the importance of a positive narrative to really drive the importance of the positive impact on the public healthcare system of digital as well. But I often feel that there's not enough that's being done in the industry between private sector supporting the public healthcare system to co-create and partner. I think Novartis is doing really strong work in that space. Have you seen others in the industry working really hand in hand with governments and public healthcare systems?
Well, last not least, the industry, and Google is one example, is working together with the World Health Organization, particularly in the response to infodemics, in the response to bringing information across in totally new ways. I think there will be an initiative also on reaching out to investors in health to discuss with them how that investment can be taken forward in the context of the work of an organization like the World Health Organization, because you need that investment in the countries, and there is much more willingness to do that. And I think also more flexibility in, at least we're experiencing that with the new industries in quotes, compared to some of the old industries in health. And we hope that that innovation through the new partners that are entering the health arena, if they are willing to work to those value principles, because of course one of the big problems and concerns has been data extraction without accountability. And if the industry is willing to face up to that issue and to contribute to this notion of data solidarity and a trust architecture, that will only benefit them as well if the trust increases, and it will benefit governments and the UN system as such.
And like all long-term change, the report is just the beginning of the dialogue. The dialogue starts now. Dr. Kishbush, thank you so much.
Thank you very much for having me.
Thank you so much. Lucas, so we've talked about some of the challenges, we've talked about some of the solutions. What have we got coming up this afternoon?
That's right, Rob. So there has been a lot of talk on the chat about how we can work together and the value of working together to solve some of these challenges. And so we are inviting you to come back once the lunch break is over at 1:30, where you'll have an opportunity to really get together and figure out how we can work on these challenges together. So starting at 1:30, we invite you back to the main stage, and from there you'll have an opportunity to jump into one of the 11 breakout sessions which will be focusing on a specific challenge that the healthcare system is facing. And in that you'll be able to jump into a masterclass with Deloitte. There is also another one on pain management from our DayOne Accelerator, and then there's the patient challenges which you heard about this morning. After that, you'll be invited back to the main stage where we have our industry and entrepreneur panel, where we'll be hearing from leaders in the industry about what they're doing and what we need to do to solve the future of healthcare together. Finally, at 3:20, we will hear from David Rohn on the future of healthcare and his view on that. So bon appetit, enjoy your lunch, and we'll see you back here in about an hour.